Hello, everybody. Dr. Maryellen here, bringing you the fourth and the final webinar as part of my Women's Health series that I created for the month of May, celebrating all things about women's health and how to put your best self forward. So tonight I'm diving into another one of my favorite topics, how to radiate from within. So if you have skincare concerns, if there are something happening that is triggering an imbalance in your skin, I'm here to help you figure that out. And I'm here to help guide you and direct you with what you can start to do and start to implement to get that balance back and to put your best face forward. So on the agenda tonight, I'm going to be talking about factors affecting skin health and things that I look at as a naturopathic doctor that are contributing factors to your overall skin and what it looks like and what is happening and what it's telling us. Because after all, the skin being your biggest organ, it is a mirror as to what is going on beneath the surface. So whenever we have imbalances or inflammatory reactions in the skin, we always need to take that look deeper to see what is contributing to that. So we'll talk about your gut health and microbiome, stress, and your hormones and see how those are affecting your skin. We'll take a look at face mapping, which is a popular one. I'll share an image with you that I shared on my Instagram that got a lot of shares and likes, and people find that very interesting, how different areas of your skin and different areas of your face actually tell us a little bit about the underlying imbalances that are contributing to outbreaks there. And I will mention too, I know that I do see a lot of acne, and I talk a lot about acne when I'm discussing skin health, but the important thing to note is that there are so many other things that our skin tells us. So acne being a big symptom that I see, but eczema, psoriasis, dry skin in general can give us an indication about your thyroid health, for example, scalp hair loss. So that is the skin on your scalp, and that tells us a little bit about your hormones and what might be happening, especially if that's happening in the context or in conjunction with cystic acne as well, and aging skin. So there's certainly a lot that we can do to help protect our skin and not, favor that accelerated aging pathway that is so common these days, especially with diets high in sugar, a lot of sun damage, radio, or the active oxidative stress, So oxidative species that contribute to the stress and early aging of our skin. So getting a handle on all of these things can help you age gracefully, get that glow, and it's what we're all about, right? So then, of course, I'm going to tell you exactly how to do that. So we'll talk about my method and what I like to put in place in order for you to get the skin that you're hoping for. I'll talk about cosmetic acupuncture, which is one of my favorite treatments, one that I'm so excited to offer again once I'm back in the office and providing treatments for you. And then, of course, a gift for you. So this is number 4 of my webinar series and the 4th chance that you have to enter my giveaway that I'll be announcing the winner of at the end of the month, so May 31st. All right, so factors affecting skin health. So I have a whole talk about this that I host for Goodness Me quite often. So if you haven't been able to tune in, then keep an eye out because I love presenting this one. It's quite a popular one. And essentially I dive into that gut-skin connection or the gut-skin axis. And your microbiome is that collection of bacteria that lives on your skin and in your gut. So the population of what is growing in you and on you can certainly impact the health of your skin. So your skin, as I mentioned, gives us clues as to what's happening inside the body, and your digestive system impacts many different areas of your health because it helps us make nutrients, metabolize hormones, neutralize pathogens, and make neurotransmitters, which are produced in our brain. So those trillions of bacteria, if they are out of balance, so if something is happening that's leading to dysbiosis, so where we have less favorable and healthy or good bacteria and more not so great pathogens like yeast or strep or other bacteria that can be causing different symptoms for you, whether in the gut or, chronic pain, gas, bloating, migraines, these types of things. And of course, dysbiosis is usually at the root of a lot of skin conditions, hence the gut-skin axis. We are also more prone to food sensitivities, inflammation, and leaky gut. So once again, those chronic signs of a very low-grade infection and low-grade inflammation when our microbiome is not up to par and is not the healthiest that it can be. Stress is another thing that impacts your skin. And I always like to mention there are many different stressors that impact your body. So that HPA axis, or your body's stress response, not only does it respond to mental or emotional stress, but it responds to physical forms of stress too. So whether that is inflammatory foods, or if you're eating foods that you're sensitive to, if you are having poor sleep, so your body's circadian rhythm is off, that is a form of stress as well. And of course, toxins and pollutants, and the rate at which your liver is able to detoxify those day to day. So liver plays a big role in the buildup of toxin and pollutants in your body. And I talk a lot about endocrine disrupting chemicals, or things that are not natural, that are included in a lot of our personal care and household products. So things like fragrances or PCBs or phthalates. These things certainly go in and mess up a lot of our hormonal processes and cause a lot of inflammation. And of course, when we're dealing with mental, emotional stress, or any of these stressors, cortisol, which is the stress hormone released from your adrenal glands, that signals an inflammatory cascade. So it signals to your immune system to start the inflammatory process, and this can actually worsen the skin. So I see this happen a lot when people are getting hives, acne, eczema, or psoriasis flares, especially in times of stress. So that might be very relevant to the past couple months that we've been dealing with a change in the world, different schedules, potentially financial burden as well, with job changes. So if you have been experiencing a worsening of your skin symptoms, know that you're not alone, and that it's your stress response that you can thank for that. Okay. Then, of course, we have to look at your hormones when we are looking at the skin. So in particular, the hormones that I'm looking at are your estrogen. So low estrogen as we age. Estrogen naturally is on the decline, but of course, low estrogen leads to dry, aging skin. And this is also because we need adequate amount of estrogen to keep collagen in our skin, which collagen keeps it nice and plump and hydrated. Aside from the aging side of things, poor estrogen metabolism can lead to things like hives, atopic dermatitis, acne in some cases too. So I see a lot of issues with our estrogen metabolism. So the way your body is breaking down estrogen and getting rid of it, especially if you are coming off the hormonal birth control pill and all of a sudden have a flare of acne a few months later, this is likely due to a poor detoxification of that synthetic estrogen, among other things, but definitely something to look at. Another hormone that's important, or group of hormones, are your androgens, or that testosterone and DHEA. So these usually get dubbed the male hormones, but they are certainly important in females too. And when we have high androgens, this can lead to cystic acne and oily skin, especially on that jawline, the very painful cystic deep acne. And this is very common in women who have been diagnosed with PCOS, or polycystic ovarian syndrome. And in general, a progesterone estrogen imbalance can lead to many, many things, but acne, dry skin. We also see dry skin if there's issues with your thyroid hormone. So all of these things taken into consideration can really, really give us some clues as to what's happening with your body. Symptoms and testing go hand in hand whenever I'm looking at a given clinical picture. So your symptoms do tell us a lot, and your symptoms are our first line of clues that something is going on and you're experiencing an imbalance. But there's lots of testing, as you've heard me talk about before, that helps me get that info and that insight that I wouldn't otherwise be able to know, and can help me really guide treatment. So testing for our hormones is really great and very valuable when we're dealing with acne or any skin condition. So face mapping. Here is that very popular picture that I like to share. And I've shared it on my Instagram. I can't take credit for it, but it is a great one. I found it on Pinterest, funny enough. But it shows us, a cool representation of how different areas of congestion or acne or any skin condition for that matter, certain areas are linked to underlying imbalances in the body. So on the chin and jawline, we see a lot of issues with our hormones, right? On the cheeks, poor skin hygiene or excessive oil and debris. So this could even be things like not cleaning your phone regularly or not changing your pillowcases. Another one is, between the eyes, we see a lot of lactose intolerance, even under the eyes. I see that too, or gluten intolerance, gluten sensitivities, late night eating. So not so great food choices on the forehead. That's usually due to a stress response. So anxiety, stress, too much caffeine or other stimulants. So something that is affecting your cortisol and your adrenal glands. So how do we get that glow? So I like to take my patients through a 4-step approach. Number 1 being identifying and removing the triggers. So this is where testing can help give us that better insight as into what your symptoms are telling us. So is it inflammation and stress? Do you have food sensitivities? Are there toxins or pollutants that your liver is having a hard time detoxifying? Or are there sources of them in your daily products that we can switch out for better options to relieve that burden? Are there any pathogens or bacterial overgrowth happening in your microbiome? So what do we need to start to do to address that? Is it a hormonal issue? So once again, that high androgen, estrogen or progesterone imbalance. Are you having issues with detoxifying estrogen? Have you come off the pill recently? So what's happening there? And then diving into nutrients, of course. So I'm going to talk about this in a couple of the other steps, but there are certainly important nutrients, vitamins, minerals, essential fatty acids that are important for overall skin health for any skin condition. So vitamin A, zinc, your B vitamins, collagen, omegas 3 and 6s. Now I will make a cool note about omega 3 versus 6. And omega-3s are generally our anti-inflammatory essential fatty acids, whereas our omega-6s are generally our pro-inflammatory omega fatty acids. So usually in any given standard American diet, it's much easier for us to get more omega-6 from things like nuts and seeds and less omega-3 from things like fish, salmon, those types of things. So when we have an imbalance here and there's more pro-inflammatory omega-6s, we can actually see that inflammation coming out in the skin and more acne or eczema or psoriasis. So now, replace and rebalance is step number 2. Sorry if you can hear my little dog in the background. He's just excited about us being outside. So, of course, whenever we've identified that there is something, an imbalance taking place beneath the surface, we need to put in the appropriate support to help balance that out. So, of course, looking at hormonal support and what that means for your specific picture. So do we need anti-androgen support, estrogen detox, regulating your blood sugar and making sure insulin is all good, your cortisol, your stress response. So working at that. Looking at our nutrient deficiencies. So once again, that vitamin A, that zinc, keeping up the omega-3s that are so important for skin health too, and balancing that fatty acid profile. And then of course, we need to look at your microbiome. So it's one thing to identify if there's any overgrowth of anything that shouldn't be there. So common ones are candida or yeast that can be growing in that gut and we don't want it there. So we need to remove those offending pathogens, but also repopulate with the healthy and helpful bacteria. So your probiotics. Things, certain strains like Saccharomyces boulardii are actually great for replenishing after bacterial or fungal infections. And something really cool that we can achieve through certain probiotics is balancing out your immune system. So I talked a little bit about the inflammatory cascade that can be triggered from stress. So any type of stress or leaky gut. So things like eczema, psoriasis, other skin conditions, they are either in a Th1 or Th2 state. So depending on where you are at that end of the spectrum, we can use specific probiotic strains to help balance out that scale. So if you're too much Th1, then we can give certain probiotics to balance that out and push more towards Th2, which would be a less inflammatory state for you. And of course, aside from our internal microbiome, we need to take care of our skin's microbiome. So that means stop using harsh chemicals to strip that beneficial bacterial flora that's so protective. Start using healing oils like jojoba, squalene, calendula that are healing and gentle, and really taking inventory of the products that you're using on your skin. So the Environmental Working Group Skin Deep database is a great place to look because it'll give you a rating from 0 to 10 on how clean or how dirty your products are, essentially how harmful or how safe they are for your body, not only externally, but internally too, because anything you're putting on your skin is being absorbed right into your bloodstream. So we want to make sure it's the safest possible. And then, of course, repairing that skin barrier. So we want to replenish the moisture barrier itself. So using fatty acids like GLA, our omega-3s, hyaluronic acid, using those essential nutrients again. So do we need zinc, vitamin D, vitamin A would be another one. We want to promote collagen production. So collagen is something I talk about a lot. And especially if we want more plump skin or to prevent premature signs of aging, we want to use collagen in a supplement form. Vitamin C is a backbone for collagen, hydrating. And then, of course, with collagen production, you want to make sure your hormones are balanced and optimal too. Now, then we also want to repair scarring and hyperpigmentation. So there are many, many different things we can do for that. And I usually refer to estheticians, who are the experts in this field, but things that I can offer in practice include cosmetic acupuncture, which I'll talk about next, one of my favorite treatments, lymphatic drainage, and then some healthcare professionals or estheticians can also offer blue light therapy, collagen induction. There's red light therapy too. So lots of different things that we can do to help repair the actual physical skin, aside from doing all that internal work. So cosmetic acupuncture, as I mentioned, one of my favorite treatments. There's a picture of my lovely mom enjoying a treatment that I gave her a couple months ago. And cosmetic acupuncture is the technique of inserting very, very fine acupuncture needles into the skin, so into the dermal layer of the skin. And what this does is it creates almost micro traumas that help to recruit collagen and blood flow. So help to, promote that collagen production, fill in any fine lines, wrinkles, and scars. So really, really interesting on how, we can trick our body's own repair system to work in our favor cosmetically. So it's a nice, safe treatment that's a great alternative, or something that can be complementary to any cosmetic fillers or Botox or things like that. Whenever I perform cosmetic acupuncture, I also include facial cupping for lymphatic drainage, gua sha for muscle toning and drainage as well, and then a jade roller massage for its anti-inflammatory and soothing properties for the skin. So that is pretty much my best approach to how you can get that glow and how you can radiate from within. I have a free download for you guys called the Stressed Out Guide to Skin Solution. So it's something that Dr. Olivia Lung and I prepared when we did an Instagram live on stress and your skin. It was a popular one, so I thought, why not share it again? It's a great resource that talks about these different areas of overall health that could be contributing to your skin and what you can start to do about it. There's also another picture of a skin map on there that can help you figure out what areas of your face are giving you trouble and what might be going on beneath the surface. And of course, my giveaway to celebrate you taking that next step into overall amplifying your health and achieving optimal health, and entrusting me to work with you to achieve that. So I'm giving away a free visit, either initial or follow-up, depending if you're a new or a returning patient, and a 10% discount on any hormone test, saliva or urine. So comment on this video to let me know that you tuned in, and you'll be entered. And you can go back and comment on the other 3 webinars too if you enjoyed those, and I'll be announcing the winner on May 31st. Thank you guys so much for joining me along this journey and letting me present to you the some of my favorite topics in women's health. I think it's so important to keep this conversation going, and it's my goal to continue to empower you to make informed decisions about your health. If you guys have any further questions or would like to reach me, feel free to follow me on Instagram, send me an email. I'll put all of that information at the links underneath this video. And stay tuned because I plan to do more health series and more summits to keep teaching you guys and sharing my knowledge. All right, have a great evening and we'll talk soon.